Each year, more people die of lung cancer than breast, colon, and prostate cancers combined. Early detection is the key to survival, and Boca Raton Regional Hospital is implementing a new screening program to advance the cause. Dr. Louise Morell joins us this noon to tell us more about this. First of all, doctor, thank you for joining us.
Thank you.
Our first question here is, tell us more about this new screening program we're hearing about at your hospital.
The challenge in lung cancer, which is a very lethal cancer, as you know, has been our inability to effectively find a screening tool. Like mammography and colonoscopy has been so effective in those diseases. But there is now an approach that has been studied, and the results came out this summer. A very dramatic study that involved 53,000 individuals who were randomized between getting a spiral CT scan, a very low-dose CAT scan of the chest, versus just a regular chest X-ray. They were all smokers, and the results showed a dramatic improvement in survival from lung cancer. So we now actually have a screening tool for smokers for lung cancer.
I was just going to ask you, bouncing off that question, who is eligible for this type of screening?
So I think it's really important. This is a very specific study that looked at individuals who had smoked cigarettes or were currently smokers. Basically a 30-pack year history, which usually means 2 packs a day for 15 years or 3 packs a day for 10 years. You do the math to do that. And they have to either be currently smoking or have quit smoking within 15 years. So it's a very specific group.
I see. And now lung cancer does not always have the best prognosis, but it's found at an earlier stage that prognosis can be a better one. So I imagine that's what this screening can do.
Absolutely. That was the whole point, is that there was a dramatic survival advantage by having detected earlier cancers. And the tools that we have to treat it now are so much less invasive that it's really a meaningful difference.
You know, let's say somebody gets that bad news that cancer is found with this new screening process. What's next for them, and what's that path like from that point on?
Well, it's still primarily a surgical disease, but they can use more limited thoracoscopic types of procedures. And so we use multi-specialties. You use radiation, targeted radiation, sometimes avoid surgery altogether, and chemotherapy. So this is a screening program. Because it's a screening program, will allow patients to come even as a self-referral, and they can call in, and if they meet the qualifications. It's not yet covered by insurance, but as the next few months come out, it will be, but the price is pretty reasonable for the self-pay, really not different than a co-pay normally. So.
Okay, doctor, thank you so much for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.